What is disease? So disease is defined as a condition of the living animal or plant body or one of its parts that impairs normal functioning and is typically manifested by distinguishing signs and symptoms. We all know that's what disease is really, but to understand the difference between the homeopathic approach and conventional approach, we actually need to understand their different approach to the symptoms that we express when our body is ill. So orthodox medicine, it views your symptoms almost as if the symptoms were the disease. The symptoms need to be removed. For example, in a case of arthritis, a patient could be given painkillers or anti-inflammatory medicine. But suppression of the symptoms does not cure the disease. And modern medicine is pretty much based on the suppression of symptoms. The painkillers or the anti-inflammatories that you get, they don't cure the arthritis, although they may help to make you feel better because you're out of quite such strong pain. We would call this the law of opposites. We are given anti-inflammatories for arthritis, antacids for gastritis, antihistamines for allergies, antibiotics for infection, and antiemetics for sickness. So this is kind of the law of opposites, that whatever your body is doing, modern medicine tries to oppose that. The law of opposites, as opposed to what we're going to come on to with homeopathy, which is the law of similars. But the law of opposites, it may apply in certain situations. If you are dehydrated, you need to rehydrate by drinking more water. If you're too cold and hypothermic, you need to find and conserve heat. In these situations, the law of opposites makes sense because the law of opposites may help our body to maintain homeostasis. But these adverse conditions where the law of opposites applies, they're not illnesses. They may create balance in certain disorders and can certainly be temporarily helpful. And sometimes we do need to replace something that isn't being made. Maybe somebody isn't making enough thyroxine. But the approach does not cure illness. And when you think about when you go to the doctors with arthritis, with migraines, with eczema, basically what the doctors do, not in all situations, but in the vast majority of chronic complaints, is that they manage your symptoms and they may give you medications that you may be expected to be on for your whole life. And of course, those medications have side effects and will cause further problems with your health overall. So it's how we look at the body's symptoms that really brings the divide in between the more orthodox approach and the homeopathic approach. And again, that's not to say that the two approaches don't have some crossover points, and it's actually possible for them to work together. But the way homeopathy views symptoms, they see our symptoms as a way of bringing our attention to disease. We say nature's warnings of troubles from within. They're a way for our body to try and reimpose order and balance, and they're not the disease itself. So symptoms, even things like sweating when we have a fever, they're our body's way of trying to cool us down. An example might be if you had food poisoning. If you eat something that's full of nasty bacteria, the diarrhea and the vomiting come because your body wants to get rid of it as quickly as possible. So your symptoms are actually your body's way of saying, I've got to get rid of this. They are not the disease itself. The disease is the bacteria that's causing this, but the symptoms are your body's way of trying to help, trying to get rid of it quickly before it can affect you further. So we see the symptoms in a very, very different way, that they are part of the way of trying to balance, and we use them to try and find where the central disturbance is so that the body can actually start to heal itself. Sometimes when we suppress a symptom of disease, we may drive it deeper into the body. This doesn't usually happen with acute problems, which is really the focus of our talk today. But it may happen, for instance, if people suppress eczema, it may aggravate an underlying asthma. So this is something as homeopaths we are very careful about. We believe that especially in acute diseases, the body is always working in its own best interests, and that we need to listen to the symptoms, but not just try to suppress them. See them as a roadmap to how we're going to help to get our patient better.